for the calendar invites. If you shared that calendar invite, we don't necessarily have you documented as a registrant. So to cross-reference our attendance, it's really great to have that information in the chat box. So if you can start off by doing that, that'd be wonderful. My name is Gloria Burnett. I am the immediate past president of the National AHEC organization, as well as the Alaska AHEC program director. And I'm pleased to welcome you all to our third webinar in our series focused on preparations for the upcoming funding opportunity announcement from HRSA that will be projected to drop in January. This particular webinar's focus is on the evaluation plan and logic model section of the grant application. And we are excited to have some experts here from AHECs across the nation, one of which is one of my rock stars in Alaska. So I have to give a shout out and thank you to Lauren Stredney for leading the way and helping to develop this, this particular webinar. Lauren is our program evaluator here at the Alaska AHEC program office, and I will, without further ado, hand off to her to get us started in our next webinar.
Great, thank you, Gloria. We will have some time at the end for questions, so I'll probably address anything that pops up in the chat box then. So for now, we'll just kind of power through what we have. Like Gloria said, my name is Lauren Stredney. I am the program evaluator in Alaska. And in a little bit here, I'm going to be joined by Bridget and Nathaniel, who are both from the South Dakota AHEC. So I'll let them introduce themselves when we get to their slides, but I'll kick us off. Before I get started in the content, I wanted to do a shout out to CORE. So for those who may not know, CORE is the Committee on Research Outcomes and Evaluation. It's made up of members from AHECs all over the country. We meet once a month and basically just support each other in all things data and evaluation, especially with the annual performance report. CORE spearheads the annual data collection for the NAO and does a variety of other things. So I just wanted to do a CORE shout out, first of all, because some of the slides in this presentation are from a CORE presentation. So I wanted to give credit where credit is due. And then second, just because I know we probably have some new AHEC people on the call. And I want to encourage you, if you or someone from your team isn't already a part of CORE, email Kira Rodriguez, and I definitely encourage you to join us and get in that community of mutual learning and support. So I'm going to jump in now to what we're talking about today, and we're covering the impact portion of the funding opportunity announcement, and specifically the first part of that, which is the evaluation and technical support capacity section. And again, when we're looking at the previous funding announcement, we know that the new one is probably not going to be exactly the same, but we're doing what we can to prepare people for that. And so when we look at this section, if you read the previous funding announcement, basically what it consists of is the evaluation plan. So what we're going to be talking about is that evaluation plan and the sections that HRSA has required within the funding announcement to be included in that. And again, it's probably going to be different in this upcoming one, just because in the previous one 5 years ago, the actual evaluation plan wasn't due until a year later. And so we know that that might not be exactly the same this next time around. But again, we're going to kind of cover it to the best of our ability. So before we get into the specifics of that evaluation plan, I wanted to just include some helpful resources. I'm not going to go into these websites, but for anyone who has not made an evaluation plan before or just is not familiar with general evaluation guidelines, I really encourage you to look through some of these online guides and resources before you set about writing a plan and doing this part of the grant application. There's some really helpful resources here that I know myself and a lot of the other CORE members especially used when formulating our own plans and logic models and things like that. So this presentation will be available to everybody, and you can access the links directly yourselves. So the 4 sections that are spelled out within the previous funding announcement are listed here. It's going to be what we're going to go through today. There's HRSA required performance and progress reporting, program assessment and improvement, program impact, and logic model. And again, like I said, since the first funding and last funding announcement came out, there have been more things that HRSA asks for in the evaluation plan. We're not going to go into detail in all of those. We're just going to cover these 4 broad topics here. But keep in mind that what they specifically ask for might change slightly. Hopefully everything still kind of falls within these categories, and I don't anticipate that changing. So within those 4 sections in the previous funding announcement, they also included all of these other things that had to be within that. So like others have mentioned in the previous webinars, I encourage everyone who's writing this grant application to read through multiple times and highlight in this section everything that they say they want to see in the evaluation plan, and weave it in when you're writing it. And again, like some people have said, use these sections as your section titles. So when I write my evaluation plan, I just use the section title that they have asked for so that whoever's reading it can easily see, okay, this is what we wanted to see, and here's everything clearly laid out. So I'm going to be talking about the HRSA required performance and progress reporting piece, and then I'm going to hand it off to Bridget and Nathaniel. So that first thing, HRSA required performance reporting, is kind of a big beast, because for anyone who's new to AHEC, it changes every year what they are asking for. So here I listed just an attempt of what is currently being asked for every year. Again, this changes, the dates change, so these dates are not set in stone, but I thought it would be helpful for people who are new to at least have an idea of what are the things that you're going to be asking me to report on throughout the year. Again, take it with a grain of salt. For instance, I know that the AHEC Scholars update, I think last year we had 2 or 3 updates, and then this year there's only 1 due in March. So it does change, but this can give you at least kind of a current overview of what they're going to be looking for. And so the question that you would then think of is, okay, what data is required for these HRSA performance reportings? I need to know what data I'm going to be asked to report on in order for me to address it in my grant application, telling you how I'm going to do that. So what is the data? Again, it's a hard question to answer, but for the sake of people who are new, again, to AHEC, I would point you to the annual performance report. This is the most comprehensive performance reporting that we have to do as AHECs. This is consistent every year. We have this report. The specific items within it do slightly change, but in general, you can definitely count on having to do this. In here, I have a link to the EHB, that's the electronic handbook. So it's a link directly to HRSA's website with the current list of forms and data points that they're asking for. So when you're writing, and everybody is mute, I'm not sure where that's coming from. But when you're writing your grant application, if you're unfamiliar with the data pieces that HRSA is going to want to see, please read through in detail what all of these forms consist of, so that you know what you're going to have to be reporting on. And so as an example, here is what the AHEC Scholars form asks for. This is the most detailed level. This is the highest level of detail of any of the forms. So that's why I just chose this as an example. But you're going to need to have a way to collect all this data on your AHEC Scholars and then report that back to HRSA. So when we're talking about the evaluation plan and the grant application, you're not going to be addressing maybe every single piece here, but you're going to want to say, this is how I'm going to collect this information, how I'm going to store it, and how I'm going to report it. So I just wanted to give an example of how we handle this at the Alaska AHEC. So taking the scholars as an example, the first section of scholars details all of the demographic, program information type things we collect with the scholars application. So I would write, we collect all of this via the scholars application completed before they start the program. This chunk of information that's required, we collect throughout the year via our scholars tracking tools. We have several of them. I'll talk a little bit about more about tools in a moment, but that's where we're going to get all of that and how we're going to report that. And then finally, we have a post survey that we give at the end of each year and at the end of the whole scholars program, where we collect some additional information from the scholars. So this is just an example of how I, in my AHEC, would kind of address this particular report and list out some of the ways that we're going to get that information. So once you have a grasp of what data HRSA is going to want to see, within the application and the evaluation plan, you need to address how are you going to collect that required data. So there's a lot of ways to do that. You can have surveys, registration forms, applications, follow-up phone calls, or internet searches to see where students are currently at, all those kinds of things. I encourage you to consider qualitative data as well as quantitative data, because the stories and the quotes are helpful in reporting to HRSA the impact of your program as well down the road. So there's no one size fit all for these questions. Every AHEC has different programs, different ways of doing things. So everyone's answer to these questions is going to be slightly different. And then once I've addressed how I'm going to collect the data, how am I going to manage that data? Again, every AHEC is different. In the Alaska AHEC, we have a custom database that we use called the pipeline cache, where we keep track of all of our participant data and activity data. And I use that at the end of the year to pull reports, which I then plug into my annual performance report. So that's what I would write in my plan. I would say, this is our system, this is how we're going to do it. But another AHEC maybe just uses a bunch of Excel documents or Blackboard or something to manage. I included a link here a while back. I can't remember if it was CORE or the Education Committee, but there was a survey done of all the AHECs asking how you manage your data, just so that other AHECs can learn and get ideas from each other. So I wanted to include the survey results linked here for anyone who is maybe looking for a new data management system, or is new to AHEC and just needs something. So if you don't have a way to collect and manage your data, I encourage you to look at what other AHECs are doing that way. And then finally, the last kind of piece of the performance reporting question is, once you have the data and once you're managing it somehow, how is that data going to show that you're achieving your objectives as defined in your evaluation plan? So we're going to get into that in a little bit more detail now with Bridget and Nathaniel talking about the impact and assessment process. So I'm going to hand it off to you all.
Everyone, my name is Bridget Diamond Welch, and as Lauren said, I'm with the South Dakota AHEC and help oversee the evaluation and grant writing that we do as a program. And so what I'm going to talk through today is really this process of how do you create a logic model, where does that come from, and how does that help inform your grant writing? Really, when you start with your goal, your grant for your AHEC programs, the first thing you're going to want to figure out is, what is your goal? What are you trying to accomplish with this grant? What is the thing that you really want to do? And then you'll talk about with all of your stakeholders, which could be the members of your different programs, it could be your employees, it could be whoever that is for you. You're going to want to talk to them about what is keeping you from achieving those things. What are the barriers? And what do you need to do in order to address those barriers? Really, that is going to be the introduction to your grants. That's usually the first part of your narrative and what you write. In terms of grant writing in general, that's called your theory of change. And I'll provide an example of that in a moment. That theory of change is going to lead to the development of your strategies or your objectives. And that's going to result in your logic model. The logic model then is really going to be the place where you summarize what your objectives are and what activities you're going to do under each of those objectives. And based on those calculations and those decisions, that's going to tell you what you need to do to evaluate the specific efforts that you are going to be providing for your AHECs and for your goals and your programs beyond what is required by the grant. So I'll talk about those, but the important thing to remember here is that all of these flow together and all of them will be able to have both a table type of representation and will inform what is in your narrative when you are actually writing the narrative process. So all these things should combine. So to talk about theory of change, if we can go to the next slide. The theory of change is part of the process I always do when I'm writing a grant. And really where you start there is try to develop what type of population level condition are you trying to address? What is your goal? What are you trying to do? The mission of many AHECs is that we're going to connect students to communities, professionals, students to professions, professions to communities, and communities to better health, right? So if that's your goal, then you are going to start writing this root cause analysis about what are the general reasons why you have the problems that you do in order to meet that mission, what's standing in your way. And based on your community data, then you're going to be researching what specific things do you need to address? Who are, for example, your underserved communities? What are the different populations in your communities? Do you need to have different types of programs or strategies in order to enable you to provide services to those communities? Once you have that discussion in place, you will develop your strategies. So basically, you're going to say, okay, here's where we want to get. Here's where we want to get. Here are the things that are standing in our way. Here are the strategies that we can implement that's going to help us address these barriers that will let us get to those goals. And those strategies then become the objectives, the way that you're going to be delivering your program. I'm going to give you an example on the next slide, if we could go there. So I was not with AHEC when they wrote the last grant, so I don't feel very comfortable walking you through that one, but this is a good example of a theory of change that you can look through for a successful grant that we got through the Bureau of Justice Administration. And just so you know, even though you might not be aware of this type of work, that the underlying theory of change is the same. So here the goal that we had was to deliver substance abuse rehabilitation without having to go through an adjudicatory process. As probably many of you know, in a lot of areas, in order to get someone help, you have to actually find them guilty, and then they can actually be sentenced to help and things like that. So they actually have to go through the court of law. The goal here was to make that not be the case. So what we did is we brought together stakeholders, the sheriff's office, and some others that know about the criminal justice system and our community, and we talked through, why are we having this problem? What are the reasons why we can't achieve this right now? And so that's the root cause analysis. For example, one of the big things we talked about is that there's a lack of safe and secure housing for people who have not been adjudicated. Basically, if you have a substance abuse issue, if you're going to get into transitional housing that is protective or is sober living, you actually usually have to go through the criminal justice system, and then you can get a place in a house. we wanted to have transitional housing that people who needed help with could get in without going through that. So you can see that leads to objective 3 under strategies. So when you you'll have access to this, and when you look at it, what you're going to notice is for each of the root cause analyses, there's a strategy here that we pursued in order to address the problem that we had in place. Now, if I were to show you my narrative, what you would see is that the narrative at the front part goes through the root cause analysis in detail. We'll talk about the statistics, it's what's going on in our community, here's what the problems are. And so what you then do is your narrative provides the logic that then flows into your objectives when you get to that step. So really, you can think of the root cause analysis as the first real section of your narrative, and then when you get into the program part, that would be your objectives. Can you go to the next slide? So then what you do is you create your logic model. So the theory of change provides your strategies, but then you have to figure out how you're going to implement your strategies. And so one of the objectives that we came up with was to have a case coordinator for the state's attorney's office to run the adult diversion program. When you go back, you can actually look and see where that comes up in the root cause analysis and the strategy that was developed from that. Then what you have on the left, you'll see TTA on lead. Do you see that? If you look there, it's like the fourth box down on the left. Those start being the activities. So if you're writing your narrative, you're going to say our first objective is the case coordinator for the state's attorney's office to lead the adult diversion program. In order to have that be successful, the first thing we're going to need to do is have training and technical assistance on the law enforcement led diversion, and it stands for something, lead. Okay, so that is your activity. What you do there then is for each activity, you're going to have outputs and outcomes. Your output are the things that should occur basically by operations. You see here, it's called, how do we know we're doing the work? So for example, did we have TTA on lead? Well, how do we know we do that work? We had TTA on lead, right? It's not very complex. The outputs is just basically, if we're doing the basic things that we say we're going to do, we're going to see these things happen. So a lot of times outputs are yes or no. They might be qualitative, like Lauren talked about, like what did that look like? And a lot of times they're just going to be counts. Did we have people come in? Did we hire, you can see this, did we hire an adult diversion coordinator? Yes, no, right? That's going to be your outputs. And then you'll have your outcomes, and outcomes are basically, if you meet your outputs, you're arguing that this should be the results, or basically the impacts, the things that you should be seeing from your program. So if you have a TTA on lead that is completed, then you're going to have stakeholders will have increased knowledge and buy-in on diverse programs, right? So that's what should occur in the short term. And then you'll see that there's midterm and long-term impacts. Really, as you walk through your logic model, it really should just, one thing should lead to the next thing, and it should be fairly evident to you how they're going to be related to one another. The biggest issue you might have is when you come to impacts, is suggesting impacts you really can't measure. So you have to remember that you have to be able to measure these things. So for example, if I wanted to measure that people were healthier in general or something like that, I have to be able to figure out how I'm going to report that to the granting agency. And that can be difficult to do. So you want to make sure that your suggested impacts, long-term impacts, are something that is actually measurable. And then you do that for each one of your objectives. So you see I stopped here at objective 2. It goes on, there was 4 objectives. Each one of them had outputs, short-term outcomes, midterm outcomes, and long-term impacts. Frequently with long-term impacts, what I have is that all of the objectives lead to those long-term impacts, because all of those, basically what you're saying with a logic model is, if these things happen, then this will occur, right? So all 4 of those things together are going to lead to this, is a way to think of it. And I'm happy to answer any questions about how to do that. And I think we might have a link to, I shared the link at one point to where I use the model for a logic model. It's called VAWA Me. You can text, oh, that did not do what I wanted to do. Sorry. You can Google this as well, but it's VAWA, MEIA. And if you go to that, there are formats for, or there's little help things for logic models and theories of change that are actually really easy. They're really basic, but they're really easy to follow and understand. So if you want to go to the next one. Okay, so I'm going to turn you over to Nathaniel.
Hi everyone, my name is Nathaniel Steinlich. I'm a research associate with the South Dakota AHEC. I've worked a lot with Bridget and helping her compile the annual evaluation and also doing a lot of the other reporting such as the APR as well. So to talk to you a little bit more, so Bridget provided a really good overview of the theory of change and then how that links into the logic model and also kind of the requirements of it. But so here are kind of some additional questions to get you thinking about what do I need to put in each one of these columns? And I would say these columns aren't the end all be all. If you feel like you don't have medium-term outcomes, you're going to only have short and long-term, that's fine. Like it really depends on your programs and what you want to do. But it's all very flexible. And just think about activities, and to go through it, activities inputs are the stuff. So that's, you know, resources, staff to do trainings, you know, event locations, databases to manage people, or Zoom conferences. It's the things to do what you want to do. And then what are you going to do? Are you going to do presentations in middle school classrooms to get them thinking about healthcare careers, or are you going to be doing clinical experiences for medical students and PhD students? That's really what that first column is talking about what you're doing and what you need to do it. Then you're going to go into your outputs. And the outputs are basically everything Lauren talked about for the APR. You don't need to list all of them in your logic model, list the ones that are really important to you. But that is really what the APR is collecting, is output data. So think of it as like counts, like how many people did we get? How many like advertisements did we do? How many presentations did we do? Those kinds of things to know, like, are we doing what we said we were going to do? And then your outcomes are basically saying, is it having the effect that we thought we were going to have? Or is there a change in the knowledge, skills, abilities, or perceptions of who you're trying to change? Or even if you're thinking more long-term, like, is there that broader population change, going back to your theory of change that you had identified? And so a lot of these are just really thinking through and answering these questions of what do we need to show what we want to show for our programs. And next slide is, we have an example of, so this is a different type of logic model that kind of comprises the theory of change. It's from a funded grant for the Substance Abuse and Mental Health Service Agency, specifically to train EMTs in rural areas. We have a really critical shortage of EMTs because most of our EMTs are volunteers. So you have a hard time actually getting someone to go in an ambulance and actually respond to a call. So we're trying to get more EMTs trained in rural areas. So the reason why you might be seeing like, oh, I don't see long-term outcomes of this. It's a one-year grant. So we're not really thinking long-term. We're just trying to do, for the specific grant, show that we're getting bodies into our trainings and that there's a change in knowledge. And ideally, we would love to follow up with them in like 2 or 3 years and see how many of them are still being EMTs and see why, but we just don't have the money or the time under the grant to do it. So again, that's a kind of a way you would change it. But you'll see we have 3 strategies or objectives. There are various different outputs identified to them. And then kind of 3 outcomes that we want to do. And you'll notice under outputs, there are things like marketing plan. So when you're thinking about how are we getting the work done, think about the things you need to do. So advertising and keeping track of like, are we planning to do this work? Like, how do we know that things are getting done? Showing that you've thought that far ahead is really valuable because that especially to a grant reviewer that says, hey, they know what they need to do. They have outlined this very clear checklist of what they need to do. And now they've outlined a plan of how they plan to follow it. So those kinds of things. Next slide.
We'll actually go back.
I'll actually go back for finish.
How these are smart.
Oh, another thing to think about with your objectives is SMART, which are SMART goals or SMART objectives. If you look it up, it's simple, measurable,
Specific.
If you look it up, it's an acronym, but it's basically for writing very specific and time measured examples. So specific, measurable, achievable, relevant, and time bound. So you'll see that all of them have a specific number of people you want trained within a certain time period. And based on kind of how we've laid it out in our narrative, we believe that they're achievable. So something to think about is just when you're thinking about your objectives, like diversifying the healthcare workforce is a great objective and very great and important to do, but it's even better if you can outline, we want to increase the number of non-white physicians practicing in rural areas by the end of the grant. If you can be specific, and then if you can show that your programs can do that. All right, so next slide. So now that we've got the logic model done, it's time to outline how are you going to use it. So this is the Plan, Do, Study, Act model was developed by the Institute for Healthcare Improvement, IHI. It is a rapid cycle continuous quality improvement. And that is a set of words I can guarantee will probably be in the HRSA. It's been in every single other grant we've done for them this year. It's something that they have a specific guide on, which which Lauren showed up at the top. They very much like to see how you're going to do that. And it is not a hard thing to do by any means. You're actually probably already doing it in all of your programs. Because what rapid cycle continuous quality improvement is as you can see in that chart, is it's making a plan on what you're going to do. So you're going to present to middle school students about healthcare careers. That's your plan. You then do that and you collect data. Oops, we got muted. Can everybody still hear me okay?
Yeah, now we can.
Okay. But anyways, so then the Do Act is when you're doing all of that actions and collecting some data on it. And then when you go into study, you're studying the data, how you're doing it. Are we doing what we thought we were going to do? Maybe we need to start thinking about some changes, if not. And then act. So if everything is going as you planned, you've got the number of people, kids seem to be interested, you're great. You just can keep on doing the cycle without having to do changes. But if you need to make changes, then you implement them and you start the cycle over again. So just kind of outlining that process. So for example, what we do for our AHEC Scholars program is we have our centers do monthly reports for where they outline the number of people, the number of AHEC scholars they've recruited, the current number of scholars in their program, and then they do kind of some different narratives around things we really want to know as a program office. So how is their recruitment going? How is their retention going? How are their curriculum going? And then collaborations or partnerships. So then what we do is I put that into kind of a one-pager that gets then shared out to the program office and the center directors so that everybody knows where everybody's at, especially since HRSA really cares about AHEC scholars. We want to make sure we're keeping on top of that. And so that's really what we're doing is we're collecting, the centers are implementing and then doing. We're taking that data, studying it, reporting it out, and then there's a decision of when they meet monthly if they're going to make changes or not. So you can do a lot of these. It's just outlining generally how you want to do it. If you're going to do it at a monthly meeting or you're going to do it quarterly, just say how you're going to do it. Just know HRSA is not going to hold you to meeting every single month on the first of the month. They're not going to hold you to that. You can be flexible if things change, especially since it's a 5-year grant. But just keep that in mind about how you want to use some of this data that you're collecting. And speaking of data collecting, it's also good to outline what you want to collect, especially for each of the objectives in your logic model. Each objective should, in theory, have at least one measurement, probably two, because you're going to have both a short term and an out term. And so here's some examples of them. This is also from the SAMHSA grant. So the first objective was to do like a crisis intervention training. So just a souped up version of first aid until someone with an ambulance or until they can be brought to a hospital. So just the number of people trained and if a market plan was created. So the first one is, simple, like how many people are trained, it's an output, whereas the second one is a process. And you really want to have a good mixture of both, not just for HRSA's sake, but also for your own. So you can say, okay, yes, we are doing the number of recruitment measures we're thinking, we're getting the number of partners we thought we would, we're doing marketing plans, those kinds of things. Then the second objective was to train high school students. So just the number of that's trained, that's another output one. And then the final one was the number of people passing certification tests. That's an outcome because we know they have the knowledge to be an EMT and be licensed as an EMT. And it's good to have just put this all on the table because you want to spell out, linking things back to your logic model, what you're measuring, how often you're measuring it, how you plan to measure it, and then who's responsible. So for us, we have 3 centers in a program office. And we also have HRSA in our program office. So we have about 5 people responsible for collecting a bunch of different data. So it's for us, we wanted to be clear about who's measuring stuff and when, so that when it comes time to do the APR, the annual evaluation, we know who we need to email for the data. And for your sources, you should spell those out in a paragraph following the table of, this post-training survey is going to measure these things. We're going to do it after this. Those kinds of things. It doesn't need to be super long, especially for HRSA. They don't require you to attach a full survey or anything like that, but just explain generally what it is and how you plan to use it. All right, next slide. So then finally, program impact. These are the big picture things. So I put just a couple of examples of things that South Dakota is interested in. So we have one center who is very, very passionate about increasing the number of EMTs in rural South Dakota. I can guarantee that is going to be a priority for us. Another, increasing the supply of mental health professionals. We're making a more diverse workforce. Those are the longer term impact. And you can measure these in a lot of different ways. You can do follow-up surveys. So the AHEC scholars 1-year follow-up survey. That is an impact measure, at least for us, because we're looking at how many of our scholars are practicing in a rural area. How many of them are still practicing in South Dakota? We're looking at that impact to see what our program is. Same with the AHEC Scholars tool, which is on the next slide, if you want to go to that, Lauren. This was developed by CORE, and it's a great tool. It's I would say they spent a lot of time on it, and it's great at showing the growth in your scholars' knowledge over time. It's a retrospective post-test survey. So retrospective meaning they're taking this at the end of their program and they're thinking about what they knew before the program and what they knew after. And then there are a lot of great resources that CORE has put together to show that this is probably the best way to measure some of that, rather than trying to measure people right at the beginning and right at the end. But what it is, it's a 12-measure survey with two questions for each of the core topic areas. And then CORE has some good resources on how you go about analyzing that data and then talking about that on your annual evaluation. We put that in our last 2 years. The results we've shown have been great. Our scholars are learning lots, which is great to know. So it's a good thing to talk about. And I believe CORE will be also putting some language out fairly soon. There's a group that's putting together some language to talk about this measure that you can then paraphrase or just include in your own grant application, because it is a great tool and we talk about it a lot. But I think that's everything for me.
Thank you. Yeah, and we just wanted to highlight the scholars evaluation tool specifically because it's the only impact measurement that we all have as AHECs. Everything else really in our evaluation plans and our methods and everything varies state to state, but the hope is that everyone will use the Scholars tool so that we have a way to compare and kind of merge all of our impact results together, at least for the Scholars program, as a national AHEC organization. So I wanted to mention that if you're not already using this tool, please start using it. But that is everything that we wanted to talk about. I'm just going to finally mention the folder that hopefully everyone's going to have access to. I think maybe we're going to be adding these things to the NAO site, but we have several examples of evaluation plans, some logic model samples, basically everything that we talked about. If there is a tool or a resource that is helpful for that, we have it in this folder. So please refer to it as you are building these pieces yourself if you need that extra support. And now I will open it up for questions for any of us panelists are happy to answer. But yeah, if you have a question, feel free to unmute yourself or put it in the chat box.
Thanks, Lauren. Any questions for our panelists? We will be sure to get the resources that were provided as well as the PowerPoint up on the AHEC 101 on demand. And we will also post the webinar recording as well for anyone that might have missed participating in the session live. I also wanted to note that similar to the AHEC Scholars Evaluation Tool, we have a subcommittee of the Education Committee working on some thoughts for some standardized evaluation tools for pipeline programming and developing something similar in that front. So that's kind of a work in progress. If anyone has anything they'd like to contribute or be part of that group that's working on those efforts, please feel free to reach out to me and I'll make sure as the chair of that committee, I get you in touch with the right folks. Lots of kudos in the chat box. Anyone have any questions for our panelists? Anne, did you unmute? No, okay, sorry. Didn't mean to call you out.
Thank you, everyone. That's all.
It's the end of the day for most people, so
Yes.
it's only noon in Alaska, but
Very true.
well, our emails are also in the presentation. So if anybody wants to reach out later with questions, feel free.
And there will be one last final webinar in our series in December that will be led by Linda Cragen, who is on the line right now, which will focus on budget. So more of the finance side of the house. If anyone has any fiscal staff that are supportive in grant applications, that would be a really great one for fiscal staff to attend, in addition to anyone on the teams that are contributing to budget development. So just wanted to preview that. And registration is open on the community calendar for that event on the NAO website. We are really appreciative of you, Lauren, and folks from the team from CORE and our panelists for putting this together. And if you have any questions, feel free to reach out. In the meantime, we will work on getting these recordings and resources posted. Thank you all for your attendance.